Right back to you right now. Florida Governor Ron DeSantis is starting his news conference in Tallahassee. Let's listen in.
21 of the Florida residents have been diagnosed here in Florida. 21 have been diagnosed in Florida, but there have been 5 Florida residents diagnosed and isolated in other states. 2 non-Florida residents diagnosed and isolated in Florida, and we have had 2 patients pass away since this has started. A total amount of tests are 147 are currently pending results. 301 tests have come back negative. 877 people have been monitored for a 14-day period. 353 are currently being monitored. We had 8 new cases yesterday. 12 counties right now in Florida have a patient who is tested positive. It's important to know with those cases and many of the cases in Florida, we issued an advisory, our health department, on individuals who traveled to Egypt and took a cruise or a tour on the Nile River in February or March of 2020. The instructions were to self-isolate for 14 days following the return to the U.S. We've had several passengers, not just in Florida but in the U.S., have recently developed symptoms and have been confirmed to be infected with COVID-19, including, of all the positive cases in Florida, 10 of the positive cases have stemmed from this travel on the Nile River, and then 5 of the 8 new cases the Department of Health announced yesterday was connected to travel on the Nile. Was we had the individual who passed away in Santa Rosa. His travel had been to the Nile River, and it was somewhat of an isolated case of travel. Then we had someone else test positive who had also been there. So our health department talked to CDC. CDC noticed there had been other cases, and so then once it was figured out, hey, this probably was a problem, then the Florida Department of Health issued that guidance, and I think these positive cases were as a result of that alert going out. We do have the 4 individuals in Broward County. We've linked 3 of those to Port Everglades. And so there's a epidemiological investigation ongoing with those cases. And obviously we want to get as much information as possible. So we did declare a state of emergency on Monday. That's allowing Jared's working hard to procure different supplies, line up personnel if we need it. Allows us to bring in potentially people from out of state, which is good. Today, we're announcing a further effort. I've directed Director Moskowitz as the state coordinating officer to temporarily prohibit visitation to nursing homes, assisted living facilities, adult family care homes, long-term care facilities, and adult group homes. And so these are the following individuals who are going to be temporarily prohibited from visiting these facilities. So any person infected with COVID-19 who has not had 2 consecutive negative test results separated by at least 24 hours, any person showing or presenting signs or symptoms of a respiratory infection, any person who has or may have been in close contact with a person infected with COVID-19 who has not tested negative is prohibited from visiting a facility for 14 days from their interaction with the infected individual. Any person who's traveled internationally is prohibited from visiting for 14 days subsequent to their return to the United States. Any person who traveled on a cruise ship is prohibited from visiting for 14 days from their return. Any person who has been in a community with confirmed community spread is prohibited from visiting for 14 days for once they've exited that community that's been effective. And then any person who physically resides in a community with confirmed community spread. So these are important efforts to mitigate the risk to our most vulnerable population to COVID-19, which is our elderly population, and particularly those who have serious underlying medical conditions. As many of you know, this afternoon, the state university system announced our state universities would take proactive steps to mitigate the risks involved with our universities. And so you had universities where students are coming back have been told, wait another 2 weeks, and then folks who are going to be on spring break are told to, to wait as well. So I think that those were prudent steps. I think because you have the ability to do distance learning, they'll be able to do that and not miss a huge beat. And they're going to continue to monitoring the situation and then make the best decisions that they can. And so I think that those were prudent steps. LabCorp and Quest, in terms of testing, have started testing individuals upon a doctor's orders. And the Florida Department of Health is identifying strategic CLIA-certified labs throughout the state to increase the state's testing capacity. So we're doing tests at 3 different state labs, Jacksonville, Tampa, and Miami. This would potentially, we actually have a lot of these labs throughout the states. The question is, we got to line them up, make sure they're able and willing to do it. And so that will add to the capacity in addition to the private sector. And then, I've spoken with some of the folks at the University of Florida. They're developing a test of their own. And this is something that will require the FDA to approve it, but they are working quickly, and the FDA is willing to work on a quick basis. And so that would potentially also enhance the testing capability. We're going to hear from Mary Mayhew, but she's been traveling the state, visiting these nursing homes. She's the secretary of ACA. She tries to get in. They're taking her temperature. They're asking her the questions. So they have responded positively to the guidance, which we very much appreciate. In terms of the election on Tuesday, Jared is working with Secretary of State Laurel Lee, who's also working with the local supervisors of elections. I mean, the election's going to go on. There are, though, in certain counties, sites where people will actually vote in an assisted living facility. And if it's the residents in the assisted living facility, obviously that's fine, but you actually have some of these sites where the general public will come into the ALF. We obviously view that as problematic. Now, supervisors have the authority to make those changes as they see fit, but our recommendation would be that if there's a polling location, assisted living facility, allow the residents to vote there, but maybe the general public should have the option or should be directed to go to a different polling location. And I think that there's ways to do that. And so Jared and Laura Lee are working with the local folks. But I think that's a prudent step to take. So we're continuing in our efforts. We've been working with a lot of different folks throughout the state. I mean, you got a lot of people at the municipal level working very hard. Obviously, we have county health departments in all 67 counties. The private sector has been very responsive in working with us constructively on these issues. And then we've gotten great feedback and work with CDC and the folks on the coronavirus task force up in Washington. So we appreciate everyone that's been involved. And obviously, we're going to continue. We do not have, I spoke with Director Redfield and Dr. Fauci last night. Florida was identified as one of the 4 states. And it was said that there was, quote, community spread. We discussed, because that 3-person cluster in Broward can all be linked to the cruise ship, that technically doesn't qualify as community spread, which would be multiple people who we don't know where they got it from. And so we haven't necessarily gotten to that point yet. But we were cited as one of the states. We were number 4 for infections, but we were pretty far below the top 3. But they cited us for taking some of the mitigation steps that we're doing. And so we're working very hard to isolate the cases as they come in, contain the spread throughout Florida, but also taking steps to mitigate any potential damage if you end up having a situation where you do have verified community spread. And so with that, we're going to have this Surgeon General say a few words, Secretary Mayhew, and then Director Moskowitz. So.